I always come with an open mind. I've just let the day happen.
Just want to see, like how you're doing and what you're doing here. That's why I'm coming here.
Just to see what it was all about, really.
I'm very interested in service user and carer issues, especially services.
I expected it to be informative, for us to, in a way, set the agenda and to push the programme forward and to get the right people elected, or not today, but to let people know that there are places on the stakeholder board and the steering board, and to get people aware.
Things have improved, but we've still a long way to go.
We sleep lots of time sleeping there, So it's nobody, like walk around in the ward, right? They just let us sleep, there for the whole day. So we need, to be mixed with the people and talk, with them, yeah.
There is a very long waiting time, which I don't know if just general support, really, particularly support while people are waiting, because they can feel quite isolated.
When we come to the lunchroom, it was so dark, and there is no activity room. Yeah, so we need the activity room there to do some activity and talk with the nurse or the doctor. Doctor is not there, but at least the nurse, like we want more nurse there.
My issues are mainly around GPs, whereby you can get derogatory remarks which can hinder your progress.
I recently said to somebody, say the word cancer and it's horror. Say the word mental health, you get a totally different reaction to that.
Some medicine, like make us, like very. The weight is going up, so why is that kind of medicine is working up? I want my language, my own language. Yeah.
I think it is wrong that the third person involved with the doctor believes what the professional people say rather than the family.
Confidentiality is one, a big one.
In the hospital, the man and woman if together, it's not good for us.
I see that the centres are closing down, people are being pushed into the community in directions they don't want to go.
So it's just a losing battle, and I think when they're put down so often that they start to lose confidence in themselves, and you get so afraid that they will eventually give up.
And also looking at rural, because I'm from a rural background.
Yeah, the food, food is a specialist food, We need the kosher, Sometimes, like nurses not giving attention, and they give us, like some other food, they not bring nice food, like the food is just only the ones. The same thing, yeah. So need to be changed,
I think speak to any carer or service user, and crisis resolution is top of their list.
And anything that improves mental health for the future, for the next generation, and because with the recession that's going on, I'm sure mental illness is going to increase, and that's not being negative, that's me being realistic about what's happening to people.
The Sahara group is like a woman, Asian women's, is mental. Is for the going there, talking and do activity. This is for the Sahara. We're doing the activity and go for trip, and they're talking with us, yeah.
There's so little help for people that have had breakdowns or been mentally ill in the past, and make a super effort to get back on their feet and find there's really no help for them.
And also we need more funding, like for the Sahara group. So this is, like we're doing very our best thing to make more funding, so we can go outside.
Go out and promote mental health and well-being for people.
And to get commissioners and people in partnership boards to get a better understanding of how the journey for service users through inpatient wards and recovery.
It's been enjoyable. It's mainly, I'm looking forward to this afternoon when we do things like the workshops and get a bit more involved.
Workshops, you hope, have a practicality about them. Something at the end of the workshop comes about. It's not just a talking shop where ideas are thrown about and then at the end of the day, 24 hours later, they're all in the waste bin because, well, we had a little chat and it was nice to talk, but so what? We've got professionals looking after the system. We know what we're doing. Who are these people? They're only service users. Who wants to take any notice of them? That's the attitude I thought I was getting, but I think now, I think it's going to be more practical. We're going to see some results. Hands-on, exactly. So if you feel you're contributing, then you're more likely to contribute again.
I'm hoping that this urges change because I'm really depressed with how things are at the moment.
We thought that there should be fewer subjects, but taken in greater detail so that we can take away something that will benefit us. That's what we thought. We thought that we needed specialists to come in and speak about specialist subjects, like a specialist on medication, so that we'd understand it more. A specialist on what recovery really means, and not just going back to work, but recovering a quality of life, which can be upheld by many organisations without having to go to the standard workplace, but also help in the workplace when one is capable of going back or is young enough to go back.
I've been a carer for the last 16 years and I've come here looking for hope, and I think today is possibly the start of a process, but we need some big leaps and not small steps.
And I've got to meet quite a lot of people who are in a similar situation, and there's a lot of knowledge and expertise around here, and I think it's been a very valuable day for me. I've learned a lot.
I think it's been okay, considering it's the first time. Perhaps there's not been enough time for us talking and giving our views on what should happen. Rather sort of the morning, perhaps providing certain essential information, but perhaps there should have been more space for us to say what we wanted and to pull that together in a more active sort of way. But it is the first time, so I wouldn't, there's room for improvement.
I thought it was a bit boring, to be honest, and I thought the catering issue was a bit of a the room. I think it would have been easier just to put sandwiches on the table instead of having to queue up.
The workshop that I just come out of, and we talked about lots of things in a very small space of time. One of the things that came out was people didn't really still understand what the programme was about. People are interested, but they didn't quite feel that the interpretation was as clear as it could be for and inclusive for everybody to understand.
And I think rather than having just speaker after speaker after speaker, I think there could have been a bit more involvement.
We came here at 10:30 and it took until 1:30 for service users and carers to have the opportunity to have a voice in that workshop. So the morning maybe needs to be changed to involve service users and carers more.
So we've just done the workshop now and we've all given our views, so hopefully the next one that comes up there might be a bit of improvement. But I think, I don't know if this is the first one, it's like trial and error, isn't it?
Yeah.
So I suppose it's just, you've got, if it's the first one, you've got to work out, you find out then what works and what doesn't work.
I think the first part up to the workshops was instructive, but not as constructive as I would like. But the workshop we've just been in was excellent. Everybody was speaking, had their say, and I believe we came up with some good comments that hopefully will help generate a better conference next time. But overall, it's been very good.
About the meetings, what goes on, and very interesting. It's interesting. It's good figures.
The conference seems quite good actually, quite informative, quite friendly.
I would like to make sure that at the end of the 18 months there is a good legacy to pass on to whoever picks up the baton. I hate picturesque phrases, but that's the only way I can think of saying it. I think it's got to have a life and not just somebody think at the end of the 18 months, well, we can pack our bags, we've done our 18 months and it was stored on somebody's back shelf. It's got to be something that's long running, long after the initial programme's finished.